कोई नहीं जितना का जूम होगा हर मैं वगैरह आ गई हूँ। हाँ पर मैं ना ये तो मैं उठी हूँ उनसे बस से कह रहे हैं नहीं, बताओ तुमने रीडिंग नहीं करनी। हाँ ठीक है देखो मैं तो इतना
Hello, everyone. Thank you so much for coming. It is 9 o'clock, so we do have to get started. We have a live audience online waiting for us. If everyone could take their seats, um, people can still usher in while the meeting is going on, and we hope you got tea and coffee outside. If you do have a coffee, you need to have a lid on it. That is, I don't know if they told you that outside, so I'll bring some lids in for everyone. Okay, thank you so much for joining. Katie?
Shall I begin? Are we live for our live audience? Brilliant. Okay. So a warm welcome to the first planning session for World Radiotherapy Awareness Day, or RAD, which we propose to launch next year in 2025. I'm Katie Wakeham. I'm a clinical oncologist here in the UK and co-convener of London Global Cancer Week. And I'd like to introduce my co-host for this session, Sandra Turner, who's a radiation oncologist from Australia. I'm here with our in-person audience with some important society, advocacy and charity leads, and we welcome all of those who are attending in person and online. It's wonderful to have such great support from our radiotherapy community. Over to you, Sandra.
Just checking whether I'm on the screen. I can't tell from where
You
I
are,
am.
Sandra. You can go.
Hey, hello everybody. So look, we're part of a small group of enthusiasts who came together with a common vision to establish a World Day to highlight the vital role of radiotherapy, or if you prefer, radiation therapy. If that's what you use in your part of the world, it is completely okay. So from now on, we're going to say words and use the name of our movement as RAD, as Katie's already said. And please start by sharing some quotes or pictures from today using the hashtags that we put on the screen. We've chosen hashtag World Radiotherapy Awareness Day, hashtag World Radiation Therapy Awareness Day, which we know is a big mouthful, but we want to get what radiation is out there to the world, or if you prefer, hashtag RAD 2025 or hashtag RAD, full stop. So we'd like to thank you all for taking time today, wherever you are, to join us. We're really delighted to welcome individuals, professional bodies and societies, potential sponsors, consumers, patient advocates and their carers and families, and many types of radiation therapy professionals from all parts of the globe. And we'd also like to thank our sponsors who helped make this in-person meeting possible. Wish I could be there in person. So they are Accuray, Amethyst Radiotherapy Group, Electa, Icon and Varian. So our thanks to you, plus our early supporters for the initiation of this idea. and the co-hosts of our meeting who are Targeting Cancer, Radiotherapy UK, and the Global Coalition of Radiotherapy. So thank you already for your ideas and input from many of you to our first survey to support the RAD movement. We've had over 250, and we might even update that number, registrants for our sessions today for World Radiotherapy Awareness Day. So it just shows the enthusiasm for this movement. So back to you, Katie.
Thank you. So the overarching aim of RAD is to highlight the significance of radiotherapy in cancer treatment and how it can improve people's lives by curing cancer and relieving suffering. I know that I'm speaking to the converted in this audience, but we believe that RAD will help in a number of following ways. So the first is to raise awareness about the role of radiotherapy for cancer treatment. Next, to highlight the need to improve access to radiotherapy, which is a major issue globally. Third, to educate healthcare professionals, patients and policymakers about the importance of radiotherapy. And last but not least, to recognise the importance of all radiotherapy professionals. Back to you, Sandra.
So it's clear from all the input and ideas already that we are all passionate about improving awareness of and access to radiotherapy. And I'm sure we also share a belief, and that's why we're here, that bringing our voices and various activities together to focus around a common day, which will more likely be about a week with the lead up, can only make our case stronger to help our patients. So it's very difficult with such a large number of people to get your input today, but we're going to do our best to do that. We'll be using Mentimeter to gather more information about who you are and your ideas. So please have your phones or mobile devices ready so that you can scan the QR code and participate when we do our polling questions. It's amazing really that knowing how vital radiotherapy is to cancer control and cure, that it doesn't have its own World Day. But we are going to change that. We're confident that getting everyone here together and going forward, that we can actually make World Radiotherapy Awareness Day a reality and a resounding success. So thank you again for all being here today. Over to you, Katie.
Thank you. We've received many lovely videos from our friends and supporters, and we're going to play a video clip in a moment. We'd also encourage anyone who's not submitted a video or a message to carry on sending those in to us on the lead up to RAD next year, just to allow us to sort of continue to spread the word.
Today we are here to share with you the importance of radiotherapy in cancer treatment. I introduce to you the first World Radiotherapy Awareness Day 2025. Research is our resource. We build for the future. Here we go.
I'm joining the World Radiotherapy Awareness Day initiative because I believe by working together, we can improve outcomes for patients around the world.
And I'm supporting World Radiotherapy Awareness Day, as every patient who has cancer deserves the right to know if radiotherapy is an option for them.
I believe that together we can show the world what a different radiotherapy can make for all our cancer patients.
Because I know the vital role radiotherapy plays in cancer treatment.
Yes. I want to see everyone get their access to this vital cancer treatment.
A global community coming together to improve access to a life-saving cancer treatment. What could be more powerful than that?
As an advocate from a country of over 220 million people with barely 10 functional linear accelerators, I support the World Radiotherapy Awareness Day.
Let's come together and celebrate their resilience and highlight the critical role radiotherapy plays in cancer care worldwide.
We know that people are missing out on this life-saving treatment, and I want to see that change.
Because harnessing radiotherapy is our best chance to transform global cancer care.
Because I believe it's an opportunity to raise the appeal of careers in radiation therapy.
Radiotherapy saved my life, and I believe that all cancer patients around the world should have fair access to this life-saving treatment.
I believe passionately that all patients requiring radiotherapy should have equal access to the highest quality of treatment.
Accessibility is very varied depending on where you live in the UK, let alone where you live in the world. Let's fight for more funding, more research, more investment.
Like so many others, I'm only here because I received timely and effective radiotherapy. So I'm going to do everything I can to help others receive the same effective and timely radiotherapy treatment. So come on everyone, let's get behind World Radiotherapy Awareness Day and make this happen. Go on, I dare you.
So we are so impressed by everybody that sent in videos, and sorry we couldn't get every video in there. So we really encourage you, as Katie said, to share your own videos, share this video, and make sure we keep building on our resources that we can spread on our socials. So now I'm going to get your input. We're going to have our first polling question. And we invite you to answer these two questions to tell us, firstly, where you are from around the world, and we might show the first QR code. Hopefully you can get in quite quickly and it will tally up the responses as we go. This is the fun bit of Mentimeter, as it registers people's responses real time. Maybe not surprisingly, we've got UK participants in this live session held in London, taking top priority at the moment. The reason we ran the RAD session in two different, very different times was to incorporate all the time zones around the world. So I suspect it will be a different mix in our next poll. Okay, so it's great to see such a range of countries and areas represented. As I said, not surprisingly from the UK and Western Europe in this particular version of RAD. Thank you. This reminds me to say that please, I can see quite a lot of questions or comments going into the chat feed. I'm not able to monitor that as I go, but we are monitoring that, and we've got people in the background keeping track of all these questions and comments, and we are going to use them as further input into the day. There is a question that I can see about the video being publicly available, and I can say that within the next little while, I can't commit to how long, but within a few days that should be up on socials. So please feel free to share that with your networks and friends. So the second question now is who you are and what your connection is to radiation therapy. Okay, so a lot of radiation oncology professionals and people representing societies. Part of my problem is that the text is so small on my screen. I'm having trouble reading the options, and they're not in the order on my screen. So actually, yes, so we've got people with official positions as the second highest, radiation oncology professionals. One patient, fantastic, and we really want to engage patients more. So thank you. That gives us a good idea of who is attending this session, and I'll pass back to Katie for the moment.
Thank you. So for the rest of the session, we don't have a great deal of time to go into depth on topics. But again, just to encourage you, for those online, please keep posting any comments or questions in the chat, and we will record those and feedback early next year. You'll also see a QR code at the end where you can add further comments. So moving on for the rest of the session, we are going to present a synopsis of the responses from the professional societies and organisational representatives, and also hear from those societies their support statements. We will then move on to voting on the design elements for the 2025 campaign, including voting on a date, a theme for 25, a logo, and our advocacy goals, but recognising that these advocacy goals may differ depending on where you're from. And we'll also go through and outline the next steps on how we're going to feedback and communicate with you.
So firstly, we're going to have a couple of stories about how RAD might be used in different parts of the world. And we're going to start with a video, recorded video, because of a terrible time zone in the US, where we're going to hear from Jeff White, who is the head of PR and advocacy for Astro, who's kindly submitted a video for us. And then we'll move to representatives from Aortic to talk about what they might do in their part of the world.
Thank you very much. By introduction, my name is Jeff White, and I am the Director of Public Relations and Strategic Communications for ASTRO, the American Society for Radiation Oncology. And over the last 7 years, I have worked with ASTRO to educate different audiences about the advances in radiation therapy, including our work on Capitol Hill, with medical students, and with the general public. My understanding of radiation therapy was limited and has been limited over the last few years to what I've learned on the job. But in 2023, my understanding changed dramatically as I became a cancer patient. I was diagnosed with tonsil cancer in 2023 and went through all three treatment types. I had surgery, 2 surgeries, 33 rounds of radiation therapy, and 6 rounds of chemotherapy. I say this just to share that my understanding and perspective of cancer has changed dramatically because of this. And my colleagues and I at ASTRO are firm believers in educating the public about the power and impact of radiation therapy. And I feel that I have radiation therapy to thank for curing my cancer. One of the programs that we are unveiling in the next couple of weeks for the general public in the United States is a public awareness campaign that our theme is going to be radiation therapy in focus. And we chose this theme for a variety of reasons, including we wanted to reemphasize the words radiation therapy because we recognize that the public gets confused about the different treatments out there, and also confusion with words like radiology. And in focus allows us to focus on different components of care and the treatment, including focus on the patient, focus on the treatment team, focus on the different types of treatments that are possible for cancer patients. So radiation therapy in focus will lead off with kind of an engaging fact versus fiction quiz so that we can gauge the public's understanding of radiation therapy. We want to dispel some of the myths that are out there, but lead with the facts, the current facts of what radiation therapy is like today. Because we certainly have heard anecdotally from patients that, their understanding is 10, 15, 20 years old, and we want to make sure that they understand where radiation therapy is today. We will unveil a series of new videos with some patient stories and hearing directly from radiation oncologists about why this type of treatment is so important and the advances that have been made. We'll have other information for patients as well as, resources for them as they go on their journey, kind of learning as much as they can about cancer care today. This will primarily be an online awareness campaign to start because we recognize that people are seeking information online, and we want to make sure that when people are searching for information that they get fact-based, focused information about radiation therapy. So we're going to be doing a series of online advertising and work with others in the field to ensure that our content is top of mind and top of search results for patients. I'll close just by sharing that, obviously I did share my story with you. I have shared my story online as well because I felt the minute I was diagnosed, I felt this was a little too on the nose for a communications person to be going through this. So it actually helped keep me focused and a little bit more sane as I thought about how can I help other patients go through this. I had access to amazing doctors that I already knew, but I will be honest, my understanding kind of was limited when we were talking about me specifically. So I wanted to make sure that I was a resource for patients. So I've shared my story on our patient education site, which is called RT Answers, as well as participating in the video series for radiation therapy and focus. So I will close with that and also thank everybody for their interest in creating a global World Radiation Therapy Awareness Day, and ASTRO is in full support of this effort. Thank you so much.
And maybe just to add to that, Jeff has told us that this is a great coincidence of launching their awareness campaign, and they'll definitely double down around the time of RAD when we decide when that is next year to amplify that campaign to other parts of the world where it's relevant. I'll hand over to Katie to introduce our next speaker from a different global perspective. Thanks, Katie.
Thanks. So it now gives me great pleasure to introduce Dr. Solomon Kabudi, who is a radiation or clinical oncologist at the Uganda Cancer Institute, and he's going to give a statement on behalf of Aortic. Thanks, Solomon.
Good morning, and thank you so much. It's a pleasure to be here and to read this statement on behalf of Aortic. Good morning, distinguished colleagues, partners, and advocates for cancer care. I bring you greetings from Aortic, which is African Organization for Research and Treatment in Cancer. I'm privileged to speak with you today about the critical gap in cancer treatment across Africa, one that compromises outcomes, denies many the chance of survival, and without urgent intervention will continue to cost countless lives. Radiotherapy is an essential component of cancer care, yet its availability remains alarmingly limited across our continent. Approximately 50% of patients globally require radiotherapy. However, this figure is projected to be higher in sub-Saharan Africa due to high number of late stage at presentation. Sadly, in a region where radiotherapy is most needed, fewer than 10 countries have sufficient capacity to meet patient demands. Across Africa, less than one radiotherapy machine is available per million people. As of 2020, only 28 out of 54 African countries had access to external beam radiotherapy, and merely 21 had brachytherapy capabilities. No country possessed the capacity to meet the estimated treatment needs. The scarcity of equipment is profound. In West Africa, for instance, the number of megavoltage machines increased from 0 in 1969 to 22 in 2019. Despite this growth, the ratio improved from 67 million persons per machine in 1979 to 17.8 million in 2019, indicating a persistent shortfall. Compounding the equipment shortage is the deficit of trained professionals. Many countries lack sufficient radiation oncologists, medical physicists, and radiotherapy technologies, especially in rural underserved areas, leading to delays in treatment and compromised patient outcomes. Additionally, the high costs associated with establishing and maintaining radiotherapy services, coupled with limited healthcare budgets, hinder the expansion of these essential services. The economic burden on patients and health system is profound, with cancer patients often paying out of pocket for a service that would be universally accessible. To address these challenges, we must do the following. 1, expand training programs. Develop and implement comprehensive training for radiotherapy professionals to build a skilled workforce capable of operating and maintaining equipment. 2, increase investment. We need to secure funding for the procurement of radiotherapy equipment and establishment of treatment centers, particularly in underserved regions. 3, enhance collaboration. Foster regional and international partnerships to share expertise, resources, and support systems. 4, implement sustainable policies. We need to advocate for inclusion of radiotherapy services in universal health coverage schemes to ensure affordability and accessibility to all patients. And lastly, advocate for investment. Encourage governments, international organizations, and private sectors to invest in radiotherapy infrastructure, training, and maintenance. Today, we're excited to be founding partners of the World Radiotherapy Awareness Day, as it serves as a pivotal platform to 1, raise awareness and highlight the critical role of radiotherapy in cancer treatment and existing disparities in access across Africa. It serves to advocate for investment in radiotherapy infrastructure, workforce development, and patient access. It's a day to educate communities, governments, and international stakeholders about the life-saving power of radiotherapy in cancer care, and to highlight the urgent need to bridge the equity gap in access. And lastly, to foster collaboration, promote partnerships among African nations and global stakeholders to share resources, knowledge, and best practices. At IOTIC, our goal is to pivot this occasion and catalyze conversations at the regional and national level to inspire commitments that bring about lasting change. IOTIC is developing regional collaborations focused on training and mentorship for radiotherapy professionals. By expanding the reach of high-quality training programs and forming a cross-border partnership, we aim to build a robust, skilled workforce capable of meeting Africa's radiotherapy needs. We're also advocating for policies that integrate radiotherapy into national cancer plans and health financing structures, because we know that universal access must be backed by strong, equitable funding frameworks. IOTIC's initiatives for World Radiotherapy Awareness Day are: 1, launch an awareness campaign. IOTIC will disseminate information through various media channels and our newsletter to IOTIC members to encourage sign up for maximum African input into design of the World Radiotherapy Awareness Day. IOTIC, through the Radiotherapy Special Interest Group Sub-Working Group, will be established to support the World Radiotherapy Awareness Day. 3rd, advocacy, SIG, or Special Interest Group, Sub-Working Group, to support this effort. And lastly, implement sustainable policies, advocate for inclusion of radiotherapy services in universal health coverage schemes, and to ensure affordability and accessibility to all patients. Development of African version of the toolkit and policy brief as core treatment modality. In conclusion, addressing the disparities in radiotherapy access in Africa requires a concerted effort from all stakeholders. By leveraging the platform of World Radiotherapy Awareness Day and implementing targeted initiatives, we can work together. We can work towards a future where every patient with cancer in Africa has access to the life-saving treatment they deserve. Together, let us make World Radiotherapy Day a catalyst for action and a symbol of hope for all Africans impacted by cancer. Please join us, IOTIC, for the 15th IOTIC International Conference on Cancer in Africa, which will take place on the 17th and 20th of November 2025 in Hammamet, Tunisia, with the theme Advancing Cancer Care Across Africa, Equity Through Empowering Research and Education, harnessing African partnership to drive quality of cancer care and patient outcomes. Thank you very much.
Thank you, Dr. Solomons, for that fantastic summary of the issues and challenges across Africa. We obviously have a lot of work to do together. We will hear from some other Society International speakers, but before we do that, we're just going to look at our last set of polling questions for the group, where we actually want you to help us vote on the day, the chosen day for RAD, starting next year. Some elements of the logo, you'll see that we've been using our temporary logo, which we've grown quite fond of, but there are other options and we'd like to get your input into that. And thirdly, we'd like you to give us your thoughts about an overarching theme that we might use over the next few years. Before I get onto those, sorry, I've got a little bit out of order here. Before we get onto those, I'm going to show you, by way of background, some responses from the Society survey, which we put out to the Society representatives that we had recorded. And we had 18 responses from different organisations and societies around the world. And these were the responses to these questions. So we asked what people's organisations' top 3 short to medium term goals were in joining the RAD movement. And perhaps unsurprisingly, the top 3 were about raising awareness and knowledge amongst the community and patients and family around radiotherapy, raising awareness amongst governments and decision makers about the vital role of radiotherapy, to highlight awareness and recognition of the role of radiotherapy professionals, and to improve workforce for radiotherapy. And then you can see listed there some other ways that people wanted to use the RAD day. So the next slide shows the Society's top 3 longer term outcomes that they'd like to see coming out of RAD. And the top one was ensuring that all patients who might benefit from radiotherapy receive it, perhaps not surprising. And second and third were better access for patients to radiotherapy in your country or region, which is obviously related to reducing the gap, and higher awareness of the role of radiotherapy in cancer care generally amongst all stakeholders. There was also a desire to pitch for better funding and ensure that radiotherapy funding was appropriate to the importance of the service. Next slide, please. We asked Society representatives how they would get involved with RAD. I'm sure you have thought about it amongst your groups or as individuals, but just we hope that over time we'll be able to give you a few more ideas and resources, and we'll talk about that a bit later. People wanted to particularly engage with social media and use that to create new content and engage everyone around that day, that could be media or social media, to participate in and promote global RAD events and initiatives that were organised, and to use the opportunity to promote radiotherapy regionally and nationally in a variety of ways. And I shouldn't miss out the other comments that people made about doing their own events for RAD within their organisations, and also celebrating their own memberships in radiation oncology workforce. Next slide, please. So in this slide, and this is what will feed in later to you giving your views on this, we asked people about campaign messages and the overarching theme that might suit people to use for the day for the next year, and maybe a couple of years beyond that. So the top three again were that radiotherapy was a vital component of cancer care and control, including maintaining and improving quality of life. Radiotherapy is a highly effective treatment for cure and maintaining or improving quality of life. And that radiotherapy, as we all know, is a very cost-effective treatment, especially when compared to many very expensive systemic therapies. So they were the top three campaign messages people voted on. We can change these, by the way, but just to give you some ideas if you haven't got this far. In the next slide, I'm hoping people can hear me. I'm getting a message that my internet is... You can still hear me?
Yeah, we can. You've come back, Sandra. We can hear you.
Great, okay. So the ideas for the overarching RAD theme for next year and beyond from the organisation societies were these. So I want you to think about these for the next few minutes, and a bit later on we're going to get you to vote and put in your own ideas about these.
She's gone. Okay. So perhaps we will move on to hearing from the society representatives, and then we'll hopefully bring Sandra back to do some of the further voting. So up first, great pleasure introducing Tom. Tom, if you'd like to come to the stage.
Thank you very much. I'm Tom Rokes. I'm the Vice President for Clinical Oncology at the Royal College of Radiologists. So we're the professional body in the UK that supports clinical oncologists and radiologists. Thank you, Katie. Thank you, Sandra. If you can hear me, I'm sure that with your energy and leadership, this will be a great success. So I think from a UK point of view, we obviously have very different challenges from Solomon's. We have lots of radiotherapy machines. We have good technology. We have pretty good access to radiotherapy. Radiotherapy is relatively cheap. Our report published in May last year showed the average cost of a course of radiotherapy is £3,700 or $4,700 US. That's cheap treatment. And we need to advocate for that, and we need to keep pushing government and policymakers to invest in radiotherapy. But what that report also showed was that only 29% of that cost was workforce. And without the workforce, radiotherapy won't happen. So a relatively small investment into that workforce will pay big dividends. And we'd like to use Radiotherapy Awareness Day to really push that message. So I think for therapeutic radiographers, it's about getting people in schools interested in radiotherapy as a career. For physicists and engineers, it's about raising that awareness compared to other jobs that they might go into. And for clinical oncologists, so where I work in Norwich, the average medical student gets 2 days in my department and may or may not even see a radiotherapy machine. We've got to push radiotherapy as a career at medical school and to people working in their early doctor careers so that they can then really want to be clinical oncologists. And I think that clinical oncology model is also key. So we're dual trained in systemic therapy and radiotherapy. That is by far the most cost-effective way to use your medical workforce if you want to improve cancer treatments. So if you're developing your cancer control programs elsewhere, really please think about clinical oncology as the right model to do that. It's the best way to reduce global inequalities in cancer treatment, which particularly affect radiotherapy. So good luck with everything, and looking forward to getting the date and the logo and everything else sorted out.
Brilliant.
Thank
so
you.
much. Thank you. Great. And next we'll be hearing from Sheng. Sorry, Sheng, we can't. You're on mute. We can't hear you. We still can't hear you.
Yep. 大家好.
Brilliant.
That means hello, everyone. Hello. That is good. Okay, my name is Xing Huang from Tianjin Medical University and the Cancer Hospital, and I'm truly honored to speak today on behalf of the China Anti-Cancer Association. So over the past 2 decades, we have witnessed the tremendous progress in radiation therapy in China and all over the world. However, the number of cancer patients who can benefit from radiation therapy hasn't reached its ideal, especially in some underdeveloped areas. So one of the primary reasons, at least in China, I believe, is that the public perception has not been very positive. So this is why today I'm very excited to join such an important and valuable event, and our society would join together to make the global awareness of Radiation Therapy Day. So it will serve as an international figure to raise awareness about the benefits of modern and precise radiotherapy. So I firmly believe that promoting the value of radiation therapy has no country, no ethnic boundaries. Let's make our society bigger and greater together. Thanks.
Thank you so much. Thank you. And now we'll go over to Imjai.
Hello. Hello, everyone. I am Dr. Imjai Chittapanarak, speaking on behalf of the Federation of Asian Organizations for Radiation Oncology, or FARO. In Asia, where cancer cases are steadily rising, so we face unique challenges from large cities to remote areas. Access to radiotherapy resources varies widely in Asia. So FARO community has been actively engaged in addressing these challenges. So we provided monthly webinar as our core activity, providing a dedicated platform for FARO member countries. Right now we have 15 countries together to share knowledge and experiences in radiotherapy. In addition to our webinars, we initiated the FARO training travel grant to strengthen training capacity within our member countries. And recognizing that each country has unique needs and strengths, we carefully identify and match training centers with specific needs within our member countries. So let's make World Radiotherapy Awareness Day a catalyst for positive change across Asia and beyond. Thank you very much.
Thank you so much. And now we'll go over to Mark. Thank you.
Good morning, everybody. It's a great pleasure and privilege to be part of this meeting. I am a clinical oncologist working in London, and I am also president of the Pediatric Radiation Oncology Society, a group which is now about 20 years old, which has a vision to create a world where every child, teenager and young adult who might benefit from radiotherapy has fair and equitable access to the highest quality of radiation oncology treatment. We are very aware, as we've heard from colleagues in Africa, that the distribution of radiotherapy facilities and the availability of skilled staff is very restricted in some parts of the world, and we would like to campaign to change that. In our regular meetings, we always try and obtain external sponsorship to allow reduced or free access to members from low and middle income countries. the state of the world at the moment is very far from what we would like it to be. And so this new initiative of the World Radiotherapy Awareness Day is a very important step in trying to make the world a better place.
Thanks, Mark. And over to our final representative, Barbara.
Good morning. My name is Barbara Jerezek-Fosse, and I'm speaking on behalf of ESTRO, the European Society for Radiotherapy and Oncology. The ESTRO vision reads radiation oncology, optimal health for all, together. Therefore, for ESTRO, raising awareness is fundamental. Fundamental to reinforce radiation oncology as a core partner in multidisciplinary cancer care, and to guarantee accessible and high-value radiotherapy for all cancer patients who need it. We know that radiotherapy is recommended as part of treatment care, a treatment plan for more than 50% of all cancer patients. However, even in Europe, at least 1 in 4 people needing radiotherapy does not receive it. World Radiotherapy Awareness Day can make a real difference, allowing all stakeholders, local, national, international, to work together and at the same time to create a critical mass globally.
Thank you so much. And now hopefully back to Sandra for our voting.
Apologies about that, everyone. Thank you to all those society leads that gave a statement. We really appreciate your involvement. It's going to be important to have everybody. And there have been some great comments coming through that hopefully we'll have a couple of minutes later on just to make those points. So now we're going to vote again with the QR code. A few people said they couldn't get access to it. So what we will do is also share this survey again, or you can write your responses in the chat box to make sure we're capturing everybody's views. We have just picked some days, which will probably turn into a week, as I said, RAD, starting next year. The options we put up there, because they seem to be away from other, either aligning with other radiotherapy-related days or away from other important cancer days, such as World Cancer Day. So we've got up there the 7th of November, Marie Curie's birthday. The 8th of November reckons the date of discovery of X-rays. The 9th of November, just to be a bit original, but add on to the previous dates. And then other options, please put in the chat box any other ideas you have. We'll try and be fair and make a consensus around this. Okay, thank you for people's thoughts. The next question is around the preferred elements of a logo. And we have got a few options there, which I hope you can see. Again, other ideas or thoughts, please put them into the chat box. We welcome any logo submissions that our wider group can view. And any other ideas about, somebody's saying that the 7th of November is World Medical Physics Day. We do know that, and we've discussed that at length. There are other radiotherapy related events that occur on Marie Curie's birthday. The feeling was that hopefully World Radiotherapy Awareness Day would actually enhance the awareness of some of those dates, and we would very much encourage people, for instance, fit medical physics groups, to make their messaging around the important role of medical physics in RAD, and we think that the general view, but please correct us if we're wrong, would be that that would only be helpful to smaller organisations or campaigns that may be able to be better recognised if they're attached to World Radiotherapy Day. Somebody said it has to start on a Monday to be a week. The problem with that is that the Monday would always change. So we feel it would be better to have a date that is the nominal date, but to work a week around whenever that date might be. In fact, I think next year Marie Curie's birthday is actually on a weekend, so it would be the week leading up to that or following that. So, but thank you for the comments. They're all things we need to think about. Okay, thank you for people's thoughts. The last question in this section will be around those themes that I showed before that have been suggested by societies and organisations already. And this is not complete in that there may be other overarching themes that you prefer. So please put all ideas into the chat box if you answer other. And we will also be sending another link so that you can put any ideas in later on after this event.
Another challenge is that.
Okay, so favourites seem to be something around radiotherapy saving lives, fights cancer, radiotherapy safe and effective are our biggest bubbles, and improving access to radiotherapy through education advocacy, and closing that, and then the other one smaller. Okay, thank you very much for your thoughts and ideas, everyone. As I say, you're welcome to keep on sending us ideas. Now I'm going to switch over to Katie again.
As expected, this has been an immensely inspiring session, and we're very grateful for everyone's attendance and input and the enthusiasm around the event. What we request from you is to provide further feedback. There'll be a QR code that is shared at the end, and this will be open until the end of this year. And we'd ask that you please share that QR code with your networks, with your colleagues, through your organisations and societies, and importantly, please share with individuals, with patients and consumer groups. We'd also ask you put into your diary our next meeting event, which will be in March. It'll be Friday the 14th of March. And at that event, we'll give all the feedback to the information that we've received and really sort of define what RAD will look like in 2025. Over to you, Sandra.
So if people want to capture that registration right now to put down a diary for the planning meeting, please do that. And then we might just flick back to the previous slide, please. So for our team, we are going to collate all of this information from today, from the polls, from previous surveys, from chat, and from input coming until the end of the year. And we will communicate with you in early 2025. As Katie said, we'll try and bring this all together in another online session. We're going to build a website to help connect and support activities and provide some resources on that, and hopefully we'll be able to launch and tell you more about that early next year. And we're going to try and secure more sponsorships so that we can continue those activities that we've mentioned. We'd value your help here, so if you have contacts or any potential supporters, industry with us now, we very much would like your contributions. I'm going to just turn over to Darian now, who is going to tell us a little bit more about the financials as far as we know them at this point.
Thanks so much. We're going to get these curtains closed so that you can actually see. We are so thrilled that, first of all, we have had the massive engagement from our entire community, as well as, I have the pleasure of being in the back of the room, so I'm seeing the engagement online. And then also, thank you for your amazing attention here today. We want this to be a sustainable effort. And with that, it takes more than just, and I shouldn't say just, but the amount of passion that has come from people like Katie, Sandra, Sarah, Lindsay, those from these organizations and from those early, thank you all for the society reps who have shared. There's a lot of passion here. We want to make this an event that will be ongoing. So we have a plan for, if you can advance the slides, we have a 3-year plan. And we'd love to get your buy-in for this. So we're looking for individual, industry, society sponsors to come in at different levels to help support this so we can raise enough money to not only have a massive virtual and global event, but also we can start engaging with media partners. We can start engaging with on-the-ground events. We'd love for you to be a part of that planning process with us as well, because this is something that we know within this group, and I have the pleasure of being from another background. I don't come here as a radiotherapy professional, and I want to help us to, and I know all of us want to help us to, have the conversation beyond our walls, so that we're sharing it with the correct people who will help us promote more awareness, more advocacy, more access for patients around the world. I had the pleasure of hearing from my mother-in-law 2 days ago, who received her first radiotherapy treatment and is doing so well, feeling a little tired. And she asked me, how do I support your efforts? I want to share with my friends at Christmas that this is something that they can do, they can be a part of. And I think this is what we expect from Radiotherapy Awareness Day. It's an opportunity for us to remind people that this is a life-saving treatment, and this is how we can better make the world aware of what it does for our patients and our patients' families around the world. So we will be inviting you to engage with us, and we'll reach out to you as well to support our efforts. Thank you.
So once again, a massive thank you to our sponsors, to professional organisations, to the patient consumer groups, our media partners, and all the sort of individuals that have made this a really special first event. We truly believe that the whole radiotherapy community can come together to make RAD a great success. Just to finish, we will please, in the next slide, you'll see the QR code. Please take a picture of that, record it. If you can, take a photo or a screenshot. Please share that. Please share with your networks and to collect ongoing feedback and to really sort of drive the engagement. So, yeah, just to conclude, thank you so much. Thank you.
For our in-person audience, please go out into the lobby if you'd like tea and coffee. We also have large signs that say, I support World Radiotherapy Awareness Day, because we are not going to let this opportunity pass, that we're all here in person. Let's start the advocacy now. We'll get pictures if you'd like. We have a photographer, but grab your cell phones and take pictures as well with them. We'll have a sign up here and then one in the landing. Take a little break. We have 30 minutes before our next session, which will be primarily our in-person audience engaging with us. It'll be fabulous. Thank you.